Well, today we're with Kate Hawkins, Senior Podiatrist at Monash Health, and discussing the use of axial heel electrical stimulation wound therapy. So thanks for your time today, Kate. We really appreciate it. Do you just want to tell us a little bit first about your work at Monash Health?
Yeah, no worries. Thank you for having me, Chris. So I am across multiple sites within Monash Health. We're mainly focusing on diabetic and high-risk foot, dealing with both acute and chronic wound population.
Oh, fantastic. And today, I think you've got a case study to share with us on your use of axial heel electrical stimulation. So perhaps take us through that. We're really interested to see what you found.
Yeah, no worries. So this is a patient that's quite well known to the Monash Health team across all our different sites because she's been with us for quite some time. So this is actually quite an exciting case study. So I'll start to talk everyone through it.
Thank you.
So this is a 47-year-old female, and she's got a 3-year history of bilateral plantar heel wounds. And so these wounds came about after a prolonged stay in ICU in 2018. So not the usual medical history for a number of our patients because she doesn't have diabetes, but underwent a liver transplant during that ICU stay, and then has quite a history of mental health concern, including disordered eating as well. And so for those clinicians and particularly podiatrists to talk through some of our main assessments or focuses that we would have, for vascular point of view, she's got palpable pulses at both her feet. She's got biphasic sounds on handheld Doppler at both dorsalis pedis and PT. We also did arterial duplex ultrasounds just to make sure blood supply was good, and it indicated 3-vessel runoff into the foot. So we were quite confident that she had ability to heal those wounds. For this patient, pain was a concern, particularly in the right foot, not so much the left foot. I don't think from 2018 to today that the left foot ever had any pain, but she reported the pain in the right foot at 8 out of 10. And she would sort of say that the pain was present all the time. There was nothing that sort of made it better and nothing really that made it worse either. Some of our consults were a little bit stressful for her because of a lot of pain on wound debridement. And so sometimes that would end in her crying throughout the consult as well, and then declining further debridement of the wounds. We trialed lots of different things, including oral and topical treatments to try and reduce pain, and nothing really seemed to work. So this was one of the main reasons that when I heard about axial heel that we actually considered trialing it on this particular patient. And so we were just hoping to get a reduction in pain levels and rather than heal the wound itself. And so then from a podiatry perspective, this is sort of some of the history that we went through between 2018 and now. So some of the referrals that we made and some of the opinions that we sought were through High Risk Foot Clinic, the plastics department, all teams within Monash Health, dermatology, a dietitian to consider a nutritional component to healing. And then we referred to a psychologist as well to work not only with us, but the dietitian. We took many x-rays over the years. And as I sort of touched on before, the arterial ultrasound. She was treated on and off for soft tissue infections and bone infection at one point. Dressing wise, you name it, we tried it. Offloading, we also dug deep with all our different options for offloading. We casted her for periods of time. She was in different walker devices like a cam boot. We applied felt padding to the foot, custom foot orthotics, heel cups. Everything we didn't improve the wound. The wound sort of didn't go backwards, but didn't improve either. And so our review period was anywhere from a week to a fortnight, and would often include wound debridement. And so this picture here was sort of how the wound appeared for most of the time from 2018 to September recently. So nothing crazy in terms of wound size compared to what we would normally see as high-risk foot podiatrists, but also to just a very stagnant wound. And so this is when we decided to put XL Heal on. And then this photo next door is 2 weeks after using XL Heal. So this wound, the picture doesn't do it justice, I don't think. This wound was actually closed. It actually still looks open in this, but this is more scarred sort of appearance. So we were absolutely wrapped. And then this a few weeks later in October, and then a couple of weeks after that again. I actually would like to get an updated picture, which I can sort of forward on at a later date. We're due to see this patient next week. But the skin integrity is even looking much better than this 21st of October image as well. And so just a little bit about our time using XL Heal from this patient's point of view. She was really excited when we sort of mentioned that we had a new product that we wanted to try. Obviously, the wounds being there since 2018, she was pretty keen to try almost anything. And particularly when I said that it could potentially help her pain levels. She was already completing her own wound care, so that was okay. We didn't need to get another service involved. We could sort of just teach her how to apply the electrodes and then change over the device every 48 hours. And it was really easy to demonstrate the application, and the patient sort of likened it to changing her headphones over on her iPhone, plugging the device in and out. She said that it was comfortable. She had no issues at any time of the day. She had no issues sleeping in the device. She said it didn't impact anything like in regards to clothing or the shoes that she wore. She was able to keep it dry the same as keeping her wound dressings dry, using a cast protector in the shower. The pain, so this again, going back to the patient's main concerns, the patient reported that the pain significantly reduced within the 24-hour period of applying the device. And then she said she'd had complete resolution of pain within 48 hours. And to this day, no pain has returned. And then with debridement of the site, there's also no pain. So she's super happy, very excited. And one of her goals is to finally be able to go swimming with her family throughout summer. So that looks like it's going to happen. And then she's also increased her ability to do some of the activities she wanted to do because there's no pain. So originally pain was stopping her from doing a lot of things, particularly she has a young daughter. So it was stopping her doing a lot with her daughter as well. So even when this device was first mentioned, the patient's daughter was super excited for her mum to trial this as well. And this is the use of XL Heal from my perspective. There was no increase in my appointment times. I think it took about a minute, and that might be an exaggeration of time, to apply the device. It was super user-friendly, easy for me to show the patient what to do. The instructions are on the packet, so I could follow those instructions and then point it out for the patient to refer back to if they needed to. It was just included in the patient's current regime, not much for her to add to. And just to confirm too, we actually made no change in the patient's wound care except the addition of XL Heal. So what we were doing had no impact on the wound healing prior. So the only thing that added into the treatment, which resulted in healing, was XL Heal. And then we have healed that wound site and really happy with how the integrity of the skin currently looks. The patient's mood has completely changed. It's like dealing with a new patient. She's smiling and joking in the appointments, happy to sit around and chat, whereas her mood was quite low previously. And now we've started discharge planning. So just also too, at the start, I said that she had bilateral heel wounds, and I've mainly focused on one foot, and it's the foot that had the pain in it, just for the purpose of this case example. But we've also used XL Heal on the other foot after achieving healing on the original right foot, and the left foot has now also healed as well. So that's the end of my presentation in regards to that patient.
No, thanks so much, Kate. That's amazing. It's really interesting when you talk about the quality of life issues that these patients have with these recalcitrant chronic wounds, and you're mentioning the daughter and so forth. It's really interesting now that we're working with XL Heal. We're hearing a lot of these stories from patients and how demoralizing it is in some ways, and how they become disengaged with their community or some of their community groups. Their friends and family get affected by this wound. It's not only themselves, and you put on top of that pain, and you start to understand some of the issues that these people are going through, and not being able to sleep properly and so forth, as well as just having a non-healing wound. And so that's amazing. Can I just ask, I noticed when you said it would basically healed in 12 days after you'd started using XL Heal. So is that 12 days after the 12-day therapy of XL Heal, or is that 12 days including the XL Heal therapy time?
12 days total. So 12 days from putting the device initially on the foot.
Oh my God.
So not 12 days after ceasing therapy, 12 days from day one. Yeah.
And she's had that since 2018 or so. Oh my goodness, that's amazing.
With absolutely no improvement since 2018.
Oh, excellent.
Yeah. So
and
incredibly exciting.
Sorry, go on.
That the patient was like someone that really stood out for our team, because it was something, the wound affected her whole life. Every aspect of her life was affected, and it started to get us down because we weren't able to improve that wound, and we weren't able to stop her pain. And every fortnight or every week when she came back, you know, there were tears. And it started to get to us as well. So it's absolutely amazing that, as I said, our main reason for wanting to use the device was to help stop her pain. And so within 48 hours, she had complete resolution of pain. That in itself was absolutely awesome. But yeah, now to be healed both feet and looking forward to summer, that's pretty epic.
Yeah, it's very special. As a clinician, I could imagine it's like, you know, running through that that finish line. You know, you've completed the marathon after so many years. But I just think that's wonderful case study, and obviously, thank you for preparing that for us and going through that for us today. And we welcome the opportunity to share that with other clinicians so that they can understand how their patients can benefit from this XL Heal electrical stimulation device and wound therapy. So thank you so much for your time today, Kate. Really appreciate it.
No worries. Thank you.